Hello, my name is Catherine, and I will be presenting on population level health education intervention project presentation. So, introduction. The four health-related problems identified among the community that I assessed based on the windshield survey and meeting with the stakeholders, meeting with the community, and being in the community was increased diabetes risk, lack of physical activity, nutrition, and lifestyle choices in children. So some background and significance based on the windshield survey and speaking with the community members show that there's a lack of physical activity and healthy food choices among children. Many children are seen walking to fast food restaurants after school, and many that are children are seen are overweight. Community members express a lack of after-school and in-school physical activity programs that are cost-effective. Most children are picked up by grandparents or other family and taken home, but others do walk to the fast food area. Demographics in this area have a high percentage of working Hispanic families. Hispanics are about 50% more likely to die from diabetes or liver cancer than whites. Low-income parents are more likely to purchase low-cost processed foods as well. So Healthy People 2020 goals and objectives. Basically, the nutritional goal is to promote health and reduce chronic disease risk through the consumption of healthful diets and achievements and maintenance of body weights. The objective to this is to reduce consumption of calories from solid fats and other added sugars. Another goal is to reduce a new onset of diabetes by combining diet and physical activity promotional programs. The objective to this is to teach lifestyle skills and to maintain a healthy body weight and healthy nutritional status. Lifestyle changes have been known to improve effective in preventing or delaying the onset of type 2 diabetes in high-risk individuals such as this case. And then the goals for physical activity is to improve health, fitness, and quality of life through the daily physical activity. Objective to this is to increase the number of children who participate in daily school physical education. So the way that I was able to determine the needs of the community was by observing the community via the windshield survey. I noticed that many people drove instead of walked. I also noticed that many of the children would walk to the fast food restaurants after school instead of participating in after-school programs. I observed the community and drove around and looked at different resources. I interviewed and interacted with the community members and asked them what they thought the needs were in their community and how I could help. The theoretical framework model used for this project was the proceed-precede model. The first 4 steps are the precede model, which help you identify the problem and how to help. So phase 1 was defining the ultimate outcome, which helped me identify the needs of the community. Thus, what could I do to improve the quality of life based on their needs? And based on my interaction with the community and community surveys, childhood health focusing on nutrition and physical activity was a major problem. Phase 2 helped me identify some issues seen by observing the community and using windshield survey. For example, one can see that there were many fast food areas that appealed to children. There was also a lack of after-school programs, and many of the children seen were overweight and also glued to their cell phones. Phase 3 helped me examine the factors that influence behavior, lifestyle, and responses to the environment. I could see how social media influenced the behaviors of the children. Many of them were seen on their phones, and they seemed to enjoy the walk together to the fast food restaurant, which was only 2 blocks away from the school. Kids were able to socialize and eat food that they can afford with minimal adult supervision. Many of the children and family of the communities lack knowledge of healthy behaviors and proper nutrition. Phase 4 helped me understand the barriers in helping nutrition and physical activity in children. For one, culture plays a huge part in lifestyle choices. Seeing that many of the children were Hispanic, they are taught to eat certain foods which may not be healthy. We may also see some reluctancy from children and families in changing the types of foods that they eat due to cultural and financial reasons. Other problems are that easy access children have to vending machines, liquor stores, and social media in the area. A lot of children were observed on their cell phones and not partaking in physical activity when it was available. There are also limited funding to school programs which provide PE and other after-school programs. So the theoretical framework model proceed onwards help you implement a project. So phase 5 was the implementation phase with the goal to teach children about nutrition, how to make wise nutritional choices, and to improve physical activity. The CDC recommends that children participate in 150 hours a week of PE in school with the expectation that children participate in activities out of school. I was able to set up a nutritional and PE class at the Nesbitt Elementary School in Belmont's after-school program with the help of the director, Sinotra Nichols. I would then implement two nutritional classes, one for K through first grade and the other second and upgrades. I would bring different foods to the program, including different fruits and vegetables, and teach them about the importance of eating healthy foods via visual and auditory learning. I would implement a mini cooking class where we would learn how to prepare a nutritious food and meal. In the end, the children would get to eat what is made and also supply prizes for those who participated. Each class was about 30 minutes to an hour long. In addition to nutrition, I would also coordinate two physical activity classes, splitting one class from K through first grade and one class from second to sixth grade. Each class was about 45 to 1 hour long. An outdoor game of kickball after running drills would be implemented. All who participated were rewarded with a surprise gift of either a yo-yo, a sticker, or a bookmark. Moving on to phase 6, which is the process of evaluation, helped me create a curriculum in a timely fashion, taking into account the program schedule and teaching an evidence-based nutritional and PE course to the children. Phase 7 helped me determine what specific goals, objectives I wanted to take from implementing these classes. For both nutrition and PE, the goal was for the children to verbalize the importance of good nutrition and the desire to partake in more physical activity classes. Phase 8 is to evaluate the outcome. Ultimately, the objective is to implement a successful program which improves the health of the children and teaches them the essential skills to live a healthy life. I hope to spark the desire to learn about the nutrition in children and the desire to eat healthy. I would also ultimately like them to seek more physical activities rather than sedentary activities by showing them that it can be more fun. Issues which inhibit change include cultural influences. As mentioned before, if parents eat certain foods, children are taught to also eat these foods and are more hesitant to change their diets. Access to healthy foods may also be difficult for children. Low-income families are more likely to purchase low-cost and processed foods. Physical activity programs are also limited as many cannot afford after-school programs. Low-income areas have limited free sport programs, and social trends also pose a risk as many of the children already have routine to seek fast food after school. It may be difficult to break away from these bad habits. And then parent involvement is also limited as many work long hours, thus reinforcing healthy eating at home is difficult. Ultimately, the school may be the one resource of healthy eating, yet it is also limited due to funding. PE programs are also limited, which restricts the children's physical activity. In teaching the children about nutrition, such as the basic food groups, how to eat healthy, and how to make wise food choices, they can learn about what foods are better for them and what foods can make you sick or more prone to chronic illness. The interventions addresses a health-related issue as children will understand the importance of eating healthy, which then reduces the onset of diabetes and improve overall health, increases physical activity, and improve lifestyle choices. The curriculum should be organized by proven successful programs such as SPARK, which is a collection of exemplary research-based physical activity nutritional programs, and these types of programs have been shown to efficiently teach children. My curriculum was based on the SPARK program, and I was able to attain different resources and then per grade level, and then how to mix the classes depending on age. It also established that the children are visual learners and learn best when they are also engaging in an activity. Hence, a nutritional meal prep class allowed me to teach them about basic food groups while still instructing them how to prepare a meal. Physical activity is also developed in this resource and shows how to engage the children in a fun, interactive game while still being fun and encourages them to do more physical activity. We ultimately addressed the Healthy People 2020 objectives of teaching lifestyle skills to maintain a healthy body weight and healthy nutrition. By having a fun program, it also encourages more children to participate, which benefits more people. Budgets and logistics. To teach 2 nutrition and 2 PE classes, I needed to buy the food I was teaching, and I limited the class to 12 students based on the supply. The after-school programs allowed me to teach my classes for free as long as I was supervised from on out, and an entire classroom was available for the nutrition class. Then for the PE class, I was able to use the outdoor facility. Again, limiting it to 12 children outside. In general, for a successful nutrition PE program, you need an experienced staff, enough supplies for staff and children, such as balls, cones, and the nutrition part, you need food and different supplies for that. Training the staff on the curriculum may be needed if their experience is low with children. Classes need to be held in an organized organization, whether it's in a school or a facility, and sometimes it may not be free. Then, depending on the amount of children in the class, more staff is needed. Experienced staff for school-age children typically get paid around $13 to $15 an hour in California. Project evaluation outcome measurements. Ultimately, the object is to implement a successful program which improves the health of the children and teaches them essential skills to live a healthy life. My main purpose in this project was to teach about nutrition and engage children in a fun physical activity. The short-term goals were met as many of the children verbalized they learned about nutrition after the class and how to prepare a healthy meal. The goals were met as many of the children who participated in the PE class verbalized that they enjoyed the class and that they desired to participate in more PE activities. I also saw some children put down their electronics to play with the rest of the children in my class, for my class. Long-term goals will need to be determined and will be seen as children make healthier food choices. The goal is to also have them participate in more physical activities and less in sedentary choices. And then ultimately the goal is to see less overweight children and participate in more physical activities. Okay, results and conclusions. The goal was to determine the need of the community and implement a project which would serve the greater good. It was determined that children in the community are at a greater risk for diabetes, lack of nutrition, and physical activity. With this information, I created a project to teach children about nutrition and implement a PE class. The goal was to spark an interest in the children to desire to learn about proper nutrition and ways they can be healthier individuals, knowing that social media and other social lifestyles can inhibit the knowledge and lifestyle choices. In the end, I learned that I can make an impact in my community if I do my research and find the right resources to implement a public health assessment. And here are my references. Thank you very much.